Hi, welcome to part 3 of Healthy Changes for Your Heart series. Today we're going to talk about exercise, stress management, meditation related to heart health, and lowering cholesterol. Presenting today will be Kaylee Coburn and Kelsey Locke, both physical therapists at the main campus in North Kansas City Hospital Outpatient Department in Physical Therapy. First, we're going to talk about stress management. Obviously, we all have stress, and sometimes it can really get to us, and sometimes it can kind of sneak up on us and even manifest in physical symptoms when we don't realize what's happening. So, increasing your activity and exercising can be a great outlet for stress. Just even getting out for walks, and we're going to talk a little bit more about what you can do to increase your activity. Planning out your week and your day can help with that stress management as well. Figuring out what you need to get done, when you need to get done, and kind of just having a plan to attack that week. Great resources for whenever you're feeling overwhelmed would be a counselor, a talk therapist, psychologist, or even doing some journaling on your own. Obviously, when we are stressed, we try to find some outlets and we try to do some coping mechanisms. So it's very important to find those healthy coping mechanisms, including exercise, instead of developing those non-healthy coping mechanisms, which can include withdrawing from friends and family, watching endless TV, overeating, undereating, or excessive drinking. Those can be kind of detrimental to your health. So making sure that you find those healthy coping mechanisms, with those resources that we talked about can be a great idea. We're also going to talk about meditation. Some of us think that we know what meditation is, but we don't fully understand what it can mean. There are several meditation apps that are out there. Some are free and have free trials, but some that you have to pay for, but they can lead you through a self-guided meditation. Some of the ones that we have found that work well are Breathe, Headspace, Simple Habit, and Mindfulness. They're nice because they're on your phone and you can take it anywhere with you. They're pretty convenient and easy to use. And then some other ones, especially when you're having difficulty with sleep, there's some great apps out there for that as well that you can use on your phone. The ones that we have found are listed below as well. And then using white noise machines or sound machines can help with the meditation, especially when you have a very busy household or help with sleeping. But when you see a counselor or a talk therapist, they can also recommend some of these meditation apps and methods as well. But they are very helpful, especially when it comes to stress and other issues that may be going on in life. Another helpful method when it comes to meditation is breathing. And as easy as that may sound, breathing is very important. Breathing can help reduce our shortness of air feeling that we get when we're working out or when we're doing anything else. It can also help with anxiety and then kind of just help with that mindfulness as well. So what we typically do in physical therapy are a couple different techniques. The first one is called pursed lip breathing. So what that does is you're going to breathe forcefully in through your nose like you're smelling some beautiful roses. And then you're going to breathe forcefully out of your mouth with your lips kind of pursed like you're blowing out some birthday candles. So doing this a few times nice and slow can actually help your respiratory rate and kind of calm that down a little bit more, but also make you feel more relaxed as well. So doing that a couple times, breathing in through your nose and out through your mouth. The other one is 4 square breathing, and there's a diagram below that kind of helps you. We're going to create a box basically when we're breathing. So what you're going to do is you're going to breathe in for 4 seconds. You're going to hold that breath for 4 seconds, and you're going to breathe out for 4 seconds and hold it for 4 seconds before you breathe in again. So you're making a square and you're counting to 4. That one's a really good one to do a couple cycles through to kind of help calm everything down. But also when you're feeling out of air or when you start to kind of panic, when you can't catch your breath, these are really great things to do, especially when you start with exercise in the beginning. It's going to be a little bit harder. So making sure that you kind of have these in your back pockets to use whenever you need to could be very beneficial. Next, we're going to talk about the benefits of exercise. So as we know, exercise can be very beneficial to our health. We can have a lot of great improvements in weight loss, improving your lab values and health conditions. It can improve your sleep. It helps with pain, especially chronic pain. It can decrease our mood swings, decrease our depression and stress levels. and it can decrease the muscle soreness and fatigue as we improve our endurance. It also helps release chemicals into the body that ease pain and the feel good chemicals, like when you get a runner's high. I don't ever get that because I don't ever run, but it can release these feel good chemicals into our body after we exercise. Regular exercise can also help prevent or manage many healthcare problems, as we know. These also include diagnosis of stroke, any metabolic syndrome, high blood pressure, type 2 diabetes, depression, anxiety, many types of cancers, arthritis, and can help with falls and cognitive functions as well. So adding to those health benefits, we talked about those lab values and how it can help with our cholesterol. Being active increases our HDL, or which is known as the good cholesterol, while decreasing our triglycerides, which is known as the bad cholesterol. It can help reduce plaque in those blood vessels, decreasing the risk of cardiovascular disease. That means your blood can actually go through your vessels without getting stuck or having a risk of a heart attack. Same with the blood flow here. It helps that circulation. When I talked about those feel good chemicals when you exercise, as you increase your heart rate and you get your blood pumping, that's going to get those feel good chemicals circulating throughout the body, those endorphins, serotonin, all those feel good chemicals that we get.
So next, what we're going to talk about is recommended physical activity. This guideline that we use is from the American College of Sports Medicine, which deems that healthy adults ages 18 to 65 should participate in moderate intensity aerobic activity for a minimum of 30 minutes, 5 days a week, or vigorous intensity aerobic activity for a minimum of 20 minutes, 3 times a week. Now, typically, it is a little bit challenging to determine what's moderate and what's vigorous for most people, especially if you're new to exercise. So the next couple of slides will kind of focus on what those mean and what those can mean to you. Each person is obviously a little bit different, and your baseline may be a little bit different. So just trying to determine what's most appropriate for you is going to be your best starting point. Obviously, it's good to be consistent with exercise, but also diversifying your activity is really beneficial and important. And just know that there are many ways to achieve your goals. It doesn't necessarily have to be specifically related to, running or jogging or anything like that. Even just something like doing strenuous chores around your home can also be considered exercise. So what I want to talk about first is your heart rate max. So the importance of this is knowing really where you need to get your target heart rate when you are exercising in general. So in order to determine your heart rate max, you're going to take the number 220, subtract your age, and that's going to be the maximum heart rate that you want to achieve. Generally, when we're exercising, our heart rate should be between 50 and 70% of our heart rate max. So there are some formulas here at the bottom that will kind of help you determine where that is. That 50 to 70% is going to get you closer to that moderate range for exercise. So this is something that you want to consider if you're trying to achieve the moderate intensity exercise 5 times a week, is to use these formulas below. This next slide here is the BORG scale. So this is probably not something that most of you guys are familiar with, but it kind of helps us determine your rate of perceived exertion. So like I said, a lot of people don't really know what is considered light versus moderate versus, vigorous activity. And so this chart can help you determine that. So it goes through a point system, which isn't necessarily super relevant in this case, but it really talks about the percent of heart rate max that you're trying to achieve with each of these levels of activity. So this will kind of basically help you determine and measure your intensity of activity, because what may be difficult for you may not be super challenging for the next person or vice versa, but it's just a good way to objectively categorize what level of activity you are at each given moment. Okay, so really the biggest thing about getting started with exercise is finding a way to stick with the exercise. A lot of times, even in physical therapy, that's what we hear is that people don't stick with things because they don't enjoy it or it's not something that is favorable to them. So you're more likely to stick with physical activity if you have a goal or a reason for doing what you're doing. You have to find something that's important to you. Walking can obviously be the easiest way to begin. You know, you don't have to go to a track, you don't have to have a park, nothing like that. You can walk in your house, down your driveway, around your neighborhood. You know, start small, work your way up. You don't have to go for a 5 mile walk the first time you start with physical activity, but just find something that you can do and you can do consistently. Make it a routine, write it down, plan it into your day, and do something that you enjoy. So if you enjoy exercising with others, then use group classes or work out with your friends or things like Zumba to kind of help encourage you and motivate you to get started with exercise in general. Every exercise class out there has some sort of modification. So I know it is a little bit intimidating sometimes to start an exercise class, but it shouldn't be. There's always going to be someone in there that's willing to help you and encourage you. So getting started and just finding something you enjoy is really going to be most important. Um, Along those lines, though, exercise doesn't necessarily require a gym. There are many, many different options and ways that we can exercise. First, taking a walk in the park, like we said, you don't necessarily have to use the park, but it is a good option. The main goal with exercise in general, and this isn't just for walking, the goal is to raise your heart rate. So, kind of like we had talked about, you know, you want to get in that target heart rate zone. So, make sure that no matter what you're doing, you're increasing your heart rate so that you can achieve those goals and be a little bit more physically active. Use your living room, a space in your house, anywhere that you've got space. Your body weight is a good form of equipment, if you will. There are obviously other things that you can use in your house, like chairs and stairs, resistance bands, stopwatches, timers. If you've got an exercise ball or handheld weights, I mean, even little things like cans of soup or water bottles or anything that has weight to it. Your body doesn't know the difference between a dumbbell and a water bottle, so use what you've got around you. Don't feel like you need to go out and buy a bunch of equipment. It can be costly. We understand that too. So just use what you've got, especially if you're just starting out. One option for many people is something called Silver Sneakers. It's through Medicare. It's a no-cost gym membership designed for seniors. So if you are a person who has or utilizes Medicare, that's something to look into, especially if you're wanting to utilize a gym space. Not all gyms accept Silver Sneakers, but there are quite a few of them, especially here in Kansas City, that work with Silver Sneakers program. And then lastly, too, is aquatic-based exercise. Aquatic-based exercise is really good in the fact that it's less impact, but it's really good for cardiovascular endurance. It helps essentially decrease the gravitational and weight-bearing forces on your body. It helps desensitize the nervous system and provides just overall general muscle relaxation, especially if you're in kind of a warm water situation. Stress on the body is good for building bones and stronger muscles. You need some sort of impact or resistance training if you can tolerate it. Now that may be something that you gradually work your way into, which is fine. But if you can get to the point of doing some sort of resistance training, that's going to be very beneficial for you as well. So how to stick with it? This is probably one of the hardest things for most people. It takes a little while to form a habit, so we've got to keep that in mind. So it feels good when you set a goal and you see some results from that, but we also have to realize and keep in mind that it doesn't happen overnight. So give yourself time, give yourself grace. Ask someone who cares about you to be your accountability partner. Someone that's going to help be committed to helping you reach your goals. So if that's your spouse, your friend, even a coworker, whoever you feel is most appropriate or necessary. Doing something is better than nothing, and it'll help you achieve your goals. Remember, when you're setting exercise goals, that this doesn't mean just setting weight goals. This scale isn't the only thing that matters. So set meaningful goals like improved walking distance or completing a workout class, like we had talked about, or even just being able to fit into your clothes better instead of just weight goals. Also, working on gradually increasing things over time. So slow and steady wins the race, and it'll help prevent inconsistency due to soreness or injuries by progressing too quickly. You want to allow your body to be prepared for movement and exercise. Stay hydrated, especially if you're, exercising outdoors or things like that, and also stay nourished. So we recommend that you eat before and after a workout, increasing your carbs and proteins. to kind of help make sure that you maintain your health and wellness, incorporate this into your activity log. So you want to log your progress to make sure that you are being as consistent as possible and you're being true to yourself with that. So write down how long you exercised, how it made you feel, when you did it, how many hours you slept, how this generally helps improve your overall health. And then we always recommend writing something positive that happened throughout that exercise program to kind of help keep you encouraged too. So, uh, along those lines, too, modification to exercise is always appropriate. You can do most exercises in sitting, lying, standing. You don't have to be up, running around the entire time in order to get exercise. It is definitely okay to modify exercise. We do that every day in what we do as far as our line of work. And that's how you get stronger. That's how you get better. And it's, those little wins of starting with an exercise and sitting and then being able to progress to standing are really something that you could, use as a positive for each of your days. And something that you should take, as a favorable thing, not necessarily a detrimental thing as far as if you have to do something in sitting. If you experience pain or you feel like you need further guidance, ask your doctor about getting a referral to physical therapy. We'd love to help as much as we can. If you're unsure, ask. That's always the motto with everything, especially health related. But also remember, you always have options with exercise. Find something that you like and do what you want to do, what you wish to do. There are lots of options. I mean, you can do Pilates, resistance training. There's Zumba classes, jazzercise, even water aerobics, like we had talked about. You can play sports if that's what you enjoy, and even some things like chair yoga. There's always a modification that you can do for any exercise, any group class. So just always keep that in mind. So lastly, we just want to thank you guys for coming and listening. I hope you learned something that was beneficial to help kind of motivate you a little bit to exercise and improve that heart health. If you do need our services as far as outpatient physical therapy is concerned at North Kansas City Hospital, our phone number is listed there. We've got 3 locations. We've got the location here at the main hospital. We've got a location in the Gashland region, and then also off of North Oak at Creekwood Commons. We treat a wide variety of conditions. You can go to our website and kind of see what those are. But like I said, if you need any further help or if there's anything that we can do for you, please reach out. Like I said, our phone number is listed, or contact your doctor and they can definitely get you in touch with us as well. So thanks for listening.